welcome. I'm Dr. LuLu Shimmick. Thanks so much for joining me tonight for 10 steps to a healthy thyroid. And let's get started. So just a little bit about me, so you can meet me. I am a naturopathic physician and I'm an expert in genetic health. I work with patients experiencing chronic disease, hormonal imbalance, endocrine disorders, gastrointestinal dysfunctions, depression, anxiety, and fatigue. Those are the main things that I work with patients on a daily basis, so to speak. And I believe that really once we dive deep down into the root of the problem of the distortion and ignite our body's innate ability to heal, we see unimaginable changes in our well-being. So we really just have to have that fire underneath the body to get things going. So my passion really lies in helping people discover their zest and joy for life that is kind of like lost along the way of illness, or it's been an acute situation and they really don't know quite what's going on. Before starting my clinic, Dr. LuLu's Naturopathic Clinic, I journeyed through many careers as a true Renaissance woman, so to speak. I studied interior design at the University of Georgia, so I love art. I have a doctorate from the prestigious Bastyr University in Seattle, Washington. It's a full medical degree. I also am an herbal formulator, international speaker all around the world, and author spreading the message of health and educating about prevention and well-being. You can check out my new book, which is called Detox, Nourish, Activate, Plant and Vibrational Medicine for Energy, Mood, and Love. You can go straight to my website and find about that, or on Amazon, you can Google Dr. LuLu and it will come right up. My podcast is also a great way to learn about alternative health and find out, of course, more about me. It's called The Genetic Genius. It's dedicated to genomics and planetary alternative health. And my book, it focuses on botanical medicine and other natural modalities to heal the whole body by optimizing vitality, increasing well-being, and enhancing cellular performance. I also facilitate plant ceremonies all around the world by connecting points to elevate planetary consciousness about herbal medicine and community. As a botanical medicine director at the Veterans Healing Farm in Hendersonville, North Carolina, just outside where I live in Asheville, North Carolina, I share my expertise with the veteran community about plants to help heal and elevate their lives. I'm also invigorated by traveling. I love to see the world with my husband, visiting different botanical gardens and anything related to delicious food. So that's a little bit about me. And tonight, we're going to be talking all about how to empower your thyroid health with the right labs, supplements, herbs, lifestyle, and more. And I'm going to be giving you my top 10 tips that I see help patients get better from thyroid problems, finally regain their life back. What are we going to be covering in this webinar today? One, I'm going to talk about the symptoms of thyroid imbalance and should you get tested, because I think that's a big one that I want to make sure everybody's clear on. Two, how reproductive hormones, gut health, and toxins affect the thyroid. And number three, my 10 steps to a healthy thyroid. So first, let's get down to the basics of the thyroid gland. Thyroid Health 101. I really want you to understand the importance of what the thyroid is, where it is in the body, and how it works, because that kind of clues us in when it's not working right. So the thyroid gland is right in the throat. Energetically, it's where the fifth chakra is. It's an endocrine gland. It's just below the Adam's apple. It's a butterfly shape. You can see that from the pink shape on the screen there. And it has two lobes, the right lobe and the left lobe. And each lobe lies on one side of the windpipe. So for instance, when you can have thyroid problems, it can crush on that windpipe and make it difficult to swallow, or a hoarse voice as well. So what does the thyroid gland do? So you probably heard that it has a lot to do with metabolism. It does do that, but it has so many other things it does. So it secretes two essential thyroid hormones that help the body's cells to function correctly. The first hormone is called thyroxine, or T4 for short. And the second one is called triiodothyronine, or T3 for short. So you'll probably hear about those, or you've already heard about those, T4 and T3. So that's what the thyroid actually omits from itself. And then the TSH, which is thyroid stimulating hormone, that comes from the anterior pituitary gland and basically tells the thyroid what to do. So, thyroid hormones are needed by every cell in the body. They affect multiple organs and pathways in the body, which is why the effects of thyroid imbalance are far reaching. And sometimes you'll see those symptoms are hard to diagnose or hard to figure out what's going on because it overlaps into so many different areas of the body. So, thyroid problems have a significant impact on energy levels, weight, so weight gain and or weight loss, mood swings. Depression is highly connected to the thyroid gland. Metabolism, either slow metabolism or fast metabolism. Cognitive function, so memory loss, and brain function or brain fog. Periods, so I'm talking about cycles and of menses, irregular cycles and irregular menses go along with the thyroid gland, and even pregnancy and postpartum especially. So those are just some of the things that the thyroid does, and you could see, okay, that's hitting a lot of different areas in the body. So these are just some common thyroid disorders I just wanted you to be aware of. If either you are attending this webinar tonight because you already have a diagnosed thyroid issue, or you're thinking like maybe you have one. So this is kind of touch base on both of those things. So these are just you can see Graves' disease here and Hashimoto's. Those are autoimmune thyroid conditions. And those are, you need to test antibodies to make sure or find out if those are part of your picture. So Graves' disease is an autoimmune condition that causes hyperthyroidism or overactivity of the thyroid. And Hashimoto's thyroiditis, so this is an autoimmune condition that causes hypothyroidism or underactivity. So a lot of times people don't quite understand those and get confused. So those are the main two aspects of autoimmune disease when it comes to the thyroid gland. Then we have thyroid eye disease. So this affects people with hyperthyroidism as a result of Graves' disease. You might have seen pictures of people that the eyes like bug out. Nodules, these are growths on the thyroid that affect how the thyroid gland works. So the actual be nodules you can feel on the neck of the thyroid cancer, a rare type of cancer that does affect the thyroid. And then postpartum thyroiditis. So this is when you have a dysfunction of the thyroid gland after pregnancy. And so those are just some of the main things, or are the main things that you can experience with a thyroid disorder. So thyroid health, right? Like I love this picture here. Wow. What do I do? And that is usually the same feeling that many patients are experiencing because they're overwhelmed and they don't know. The symptoms are so broad, they overlap with so many conditions, and they're very confused. So when we break it down on one, we look at the labs, we look at the different symptoms, things don't seem quite so scary. So signs your thyroid may be in trouble. So what I'd like you to do when you're looking at this slide, or you're looking at the handout, or tuning in later, just make some check marks for yourself. Okay, I have this, or maybe you only have one thing, and kind of see if you can make some sense of some things. So feeling cold when other people do not, this is very common. Chronic constipation or loose stool, that can be another symptom of IBS, for example. Muscle weakness, muscle pain, or joint pain. Unintended weight loss or weight gain. Feelings of depression or mood changes, mood disorders, exhaustion or nervousness. So that both sides of that, rapid heartbeat or slow heart rate, dry skin, dry and thinning hair, hoarse voice, like I mentioned, menstrual irregularities, swollen neck, really hard to swallow, and feeling nodules on or over the thyroid area. So these are all very common symptoms that can be a sign your thyroid's in trouble. And then you want to dive deeper to see if it is a thyroid issue before it develops into something more extensive. And that's what I really see with patients, is they felt some of these things, right? Like, I'm feeling exhausted, I'm having a couple of these things. And when they go to the physician, they run a test, and then the thyroid comes back normal, because the thyroid fluctuates. And if it's not in this extreme state, a lot of times that TSH, which is usually the only hormone tested, that TSH number, the thyroid stimulating hormone, will come back normal. And then the doctor, or most of the time a allopathic or regular MD, will then dismiss the patient and say, I couldn't find anything wrong, everything looks normal, which can be really frustrating to a patient when you're not feeling good. So what causes thyroid disease? So many factors are involved in the development of thyroid disorders, many of which really are out of our control. And this includes genetics, but we're going to take a look at some of the things that we can figure out or can quote unquote control. So while we can't really change our genetics, that gene code that we're born with, genetic predisposition alone is not enough. There must be a trigger that turns those genes on, and triggers or stressors vary from person to person, making a universal approach to treatment kind of tricky. So that's why, so when we have, those are called epigenetic factors, and that those things from the outside environment then affect our DNA, and everyone is affected differently because we have a different genetic code or different genetic makeup. And today I'm going to look at some of those common stressors and triggers that affect how your thyroid functions. So should you get tested? And I always say test, don't guess when it comes to thyroid, because that helps guide us what's going on. It helps us to really determine what down the road, what other treatments are needed, and how we should craft the plan. As you saw in the beginning, like you could have Hashimoto's or Graves' disease. That really needs to be determined before you start any type of treatment plan. So thyroid health, for instance, when the cortisol is continuously released, it inhibits the production of thyroid hormones. So if you're not testing all the aspects of the thyroid gland and the adrenal system with cortisol, you are not seeing if there's a bigger picture. Yes, testing is very important. If you're tuning in late or you arrived a little after I started, I put over in the chat the guides that go along with this webinar this evening, and I'll also send them out and post them on the website. And I am providing my optimal lab handout, so you can follow along with that. I'm not going to be going into detail with the labs, but that has a better explanation of every single lab and why we would want to do those labs. So yes, testing is important, especially if you've been experiencing several symptoms that thyroid disease causes. Previous slide, if you're like, wow, I'm having a lot of these things going on, or even if you already know you have a thyroid issue, but none of those things have resolved, that's when you want to take things a step further and do some further investigation of testing. So, however, the problem with hypothyroidism is that its symptoms are very broad, like I mentioned, and overlap with many other conditions. So you must get tested and have definitive results before you start on any thyroid medication, especially if it's a prescription, because you don't want to go down the road of telling your thyroid with a pharmaceutical what to do. That has long-term effects that can be very detrimental to the body. So taking thyroid medication without having a thyroid problem can be as harmful as not taking it if you do. So this is the slide here of all the labs that are in the handout. So these are the ones that I really focus and suggest that patients do when they're coming to see me with thyroid issues. So we're not going to do all of these at once, but we're going to be doing some of the main ones. So you can see TSH, thyroid stimulating hormone, free T4 and free T3, total T3, reverse T3, and then you can see in this other slide here where it says thyroid peroxidase antibody, thyroid globulin. So that's called, all of those tests I always run with patients when I suspect a thyroid issue right off the bat. And that's called like a thyroid panel or cascade panel. And that should be being run by all physicians if there is an aspect of that. So if you're seeing someone right now, you're not happy with your test results, you either see myself or another practitioner, and you can take that guide with you and say, hey, these other tests need to be run. We need to dive deeper. Iron studies, so ferritin is really important, especially if you're having irregular menses. Zinc, selenium, and vitamin D. I'm going to talk about the importance of those. Those all are very important for how the thyroid functions. Vitamin A, a really important antioxidant with thyroid conditions. Iodine, also very important for thyroid function. A celiac panel. So studies have shown that autoimmune diseases, especially the thyroid gland, are highly correlated to celiac disease. Celiac disease is a gluten intolerance disease. So if someone is having a lot of gut issues with thyroid issues, I will always run that celiac panel, because then we know if we need to be on a completely gluten-free plan or an autoimmune protocol, depending on what the patient's experiencing. So food sensitivities is another one. We can just do a food sensitivity panel. Maybe you don't have full-blown celiac disease, but maybe you have some gluten sensitivities or other grains or dairy or corn, things like that. toxic minerals. So you can see that with RBC, that's a red blood cell count, or CBC. And also we could do a heavy metals test. A lot of times heavy metals are correlated with thyroid issues, especially aluminum and mercury. And then EBV, that's Epstein-Barr virus. So if that Epstein-Barr virus can become dormant, like at a very low level, and cause low-grade symptoms. Mono, for example, is what EBV comes from. So you could think of having a really like mild case of mono for a long time. So sometimes I'll run that EBV lab test to see if that's actually the case. So you can see there's a lot of different labs here from a functional medicine practitioner view like myself that I'm going to dive deep in. So I really recommend, if you're having some thyroid issues, that you're really getting to the root cause, not just treating the overlying symptoms. So how thyroid problems affect women. In general, women have a 5 to 8 times greater risk of developing thyroid problems compared to men. That's huge, right? Because we have a lot more things that go on in our system, having children, going through menopause, having cycles. There's so many different aspects. We have a much more complicated, so to speak, hormonal system. And so that's why we can develop thyroid diseases more, I would say, more commonly than men. So women are at an increased risk for thyroid disease. It doesn't mean we're going to develop it. It's just an increased risk. And women are 5 to 10 times more likely to be diagnosed with a thyroid condition than men. So that you could see both sides of that. It could be a misdiagnosis, or it could not be diagnosed. So both sides of those. And it's estimated that millions of women are suffering from symptoms of thyroid disease and don't know it. So those numbers are actually much higher. And there's a link there in the article that states back to that study. So you can look that up if you'd like. Okay, and let's talk about thyroid health in relationship to different organs in the body. So thyroid disease has a huge effect on energy levels. If you remember back to the slides where I was mentioning the symptoms, that is very common. Fatigue is a number one complaint when it comes to the thyroid gland, and it has a huge effect on energy levels. And as a result, your libido is affected as well. So it's very common to have libido come into the picture, so to speak. So a lot of my patients will say, I'm so tired, but I don't have any energy, any sexual desire. And that's because the thyroid affects those energy levels. And the thyroid affects multiple organs and pathways in the body. And the thyroid disease has a huge effect on the energy levels, right? When your energy is running low, if you're a car, you don't have to have fuel in the tank, your levels are going to be low. You won't be in the mood for much, right? You're not going to have that sexual desire, drive. So thyroid hormones affect the pathways of other hormones. So thyroid disease can create other hormonal imbalances. So the thyroid is an endocrine organ, and it emits and receives hormonal frequencies or messages from the body. And so because of that, all the other hormones in the body then can be affected from that thyroid and communicate back to those hormones. So that's why we can see changes on both sides of the coin. So toxins, so many products that we use in our everyday lives contain synthetic estrogen-like chemicals known as xenoestrogens, and these greatly affect the thyroid gland. So without even realizing it, we're exposed to thousands of toxins every day in our environment. And those were the epigenetic factors that I mentioned earlier about genetics. They're hidden in our cleaning products, fragrances, and even the foods we eat. Of course, there are the obvious ones, such as air pollution, right around us. That's affecting us, all the air we breathe. And these toxins can interfere with thyroid hormone production from the thyroid itself at various different levels. So some toxins affect the liver, and therefore impact the liver's ability to metabolize thyroid hormones and make other hormones like estrogen and testosterone and progesterone. And others directly affect the thyroid gland or its hormones. So very different connections there coming from different aspects of the toxins in our environment. So by encountering so many of these toxins daily, our bodies have a hard time detoxifying them enough. So it's why I really stress to my patients the importance of doing a detox every season, because you need to, it doesn't have to be a super crazy intense detox, but some even shorter, maybe starting out in the beginning with a larger one and then moving into a shorter detox. We're giving ourselves a break. We're allowing ourselves to detox, helping all the endocrine organs to function well. So over time, these damaging effects, these toxins that come in, add up and can have serious impacts on our health and thyroid hormones. So try to switch out some, if you haven't looked at all of your products in a while, that can be your makeup, your cleaning products, any of your beauty products, lotion, shampoo, etc. You want to change those out from some toxic free products. So let's talk about nutrition. Nutrition is a huge aspect of the thyroid gland, especially when in its relationship to metabolism. So vitamin and mineral insufficiency. So I mentioned earlier about the gut. So you could think about if the thyroid and the gut are highly connected and the gut is not functioning properly, maybe you're having diarrhea or constipation, you're not eliminating, or you're eliminating too much, you're not going to be absorbing the proper nutrients to support the thyroid gland. So nutrient deficiencies rarely go undiagnosed because they cause severe and specific symptoms, right? If like you have a severe deficiency, it's going to be noticeable. However, many of us have vitamin and or mineral insufficiencies, which means we aren't getting an adequate amount to be healthy, but we still have enough to avoid any serious problems. So these are what I mentioned on the previous slide about lab testing. So iron, vitamin D, iodine, zinc, and selenium. Those are all really important micronutrients for thyroid health. And many women especially have insufficiencies in at least one of those that I just mentioned, and especially vitamin D. So let's talk about stress. Stress is a huge component when it comes to the thyroid gland and the adrenal system, because they're very connected, and they're in the hormonal system. So while stress alone has not been shown to cause thyroid disease, they have triggers or stressors, and those affect the way the thyroid functions. And high stress levels slow down thyroid function. So when you're in a state of stress, chronic stress, where the sympathetic nervous system is running on overdrive, then that causes the thyroid to work properly or to slow down, resulting in the reduction of T3 and T4. And remember, those were the two hormones that I said the thyroid produces, and those communicate back to the anterior pituitary gland inside the brain, which then tells the thyroid what to do, whether it needs to make more thyroid stimulating hormone or less. And so thyroid imbalance causes stress. So we have stress on the system due to stress. And then we also have the thyroid then not communicating correctly back to the system. And then we have a communication breakdown. So you need to find ways to de-stress. Look at that fun picture, doing yoga with the dog. That's so fun. I have 2 cats and I love to do yoga with my cats. They really like that. And we need to find real ways to de-stress, such as exercise, meditation, or practicing self-care. And you may significantly improve your thyroid health with just doing those foundations. You can start to see a dramatic improvement when you really start to pay attention to those foundations of decreasing stress. So start prioritizing yourself, making you number one, and treat your downtime with as much importance as your commitments. And that would be a big game changer. So let's talk about gut health. So the gut and thyroid connection. Now, I mentioned this earlier, so I'm going to touch base now on a little bit deeper level. So the gut thyroid relationship is perhaps the most overlooked aspect of thyroid health. Most people don't talk about that connection, but without a healthy gut, so that's the gut flora, the microbiome, you're not going to get really very far in balancing the thyroid. So I always bring in, and you'll see in my 10 steps, bring in probiotics and sometimes enzymes if needed to help with the thyroid function. So there is a microbiome population living in the gut that aids in converting your inactive thyroid hormones to active hormones your body can use. So symptoms such as belly bloat, weight gain, difficult periods, and skin issues can be signs that your gut is compromised, right? And your hormone conversion is then compromised. It's not what it should be. So when you don't have enough active thyroid hormones, this leads to symptoms like weight gain and fatigue. So that's the layout or the map of how that gut thyroid connection works. So your digestive system is filled with bacteria, good and bad, and proteins and broken down nutrients. That's like the gut soup. And digestive issues such as leaky gut syndrome, which leaky gut is often connected to adrenal and thyroid problems. It can really create a huge mess of the immune system and lead to an autoimmune response in the entire body, which leads to Graves' disease and autoimmune disease, those two autoimmune diseases of the thyroid gland. An imbalance in the gut microbiota, known as dysbiosis, can also trigger an autoimmune response if there are not enough healthy bacteria to out-colonize the invasive pathogens, right? It's like they overrun the show. So either of these conditions can trigger the GALT, which is the gut-associated lymphoid tissue, and that's the immune system of the gut. So when we have those reactions, they can be caused by food intolerances, like I mentioned earlier, processed or artificial foods, so eating foods that trigger an inflammatory response, or taking too many antibiotics that destroys the gut. So food intolerances such as gluten or dairy can create subtle chronic inflammation in the gut that disrupts the intestinal wall barrier, that actual a barrier of the gut. So once that barrier is then compromised, you develop leaky gut syndrome, where the proteins leak out into the bloodstream and intestinal contents such as bacteria then spill into the circulation. They spill into the bloodstream and you have an inflammatory response because the body says, I don't want those here. I don't need those. I'm going to create an inflammatory response. So that's triggered. And then these foreign pathogens in the bloodstream become overwhelming to the body. The body can't keep up because we are eating all the time. Stuff is leaking out all the time. So inflammatory responses can trigger autoimmune disease. Okay, so great. So those lays the foundation as we're moving forward so we can see what types of things affect the thyroid gland. Now I'm going to dive deep into my 10 steps for a healthy thyroid and how you can really start taking control of your thyroid. So remember, I talked about labs, toxins, gut health, hormone health, stress, mindset. So all those things I laid the foundation for, now those are going to come into play in the 10 steps to take control. Not control is such a strange word. I don't mean that. Take your life back. So one is routine. It's all about routine when it comes to a thyroid. And in general, in a chronic disease state, I really stress a routine, but the thyroid needs it especially because of the relationship it has with cortisol and melatonin. So it has a very close relationship with those other two hormones. And because of that, the routine needs to be kind of regimen to get the thyroid back on track. So these are some basics, and you'll see they're in much more detail in your guide. So to stimulate digestion, encourage AM bowel movements and eliminating toxins. That's key, especially if you have a history of constipation or you are currently having constipation. You've got to get those bowels moving. To connect with yourself and release your creativity so you set that tone for the day. That's got to be part of the morning routine. Establish regular meal time. So it's really important for the thyroid gland and the adrenal system, which is all about our energy system, to have a specific set meal time, because that is how we have this regulated energy flow and blood sugar balance. Taking supplements. So as you could see, there was a lot of nutrients that were important for the thyroid gland. And if you're in a state of thyroid dysfunction, you need to have supplements to get the thyroid back on track. And taking those supplements is very important, and at regular times during the day. AM, afternoon is needed, and PM. Power smoothies or protein shakes. These are really great, especially in that late afternoon slump when the thyroid starts to conk out, the cortisol level changes, and the adrenal glands give up. So it's important to have that extra boost in the afternoon. In the PM or evening, take a nice yoga class or take a walk. And then in the evening, enjoy detox rituals. Set the tone for relaxation so you can really have a super restorative sleep. So that's number one, setting the routine. Number two is all about nutritional support. So that's very important. And diet has a huge potential as a trigger or stressor, or as a healing component, right? If we use nutrition as a way to support the thyroid gland, we see amazing results. So too many calories, too high of a caloric intake. So you could see if your thyroid gland is functioning very slowly, you have a slow metabolism, then what happens is if you're having a higher caloric intake, that waking is totally going to happen and increase, or too few calories. Foods that mess with blood sugar, alcohol, processed foods, and even healthy foods. So if we are reactive to them, can totally mess up the whole thyroid function. So while it's okay, of course, to indulge occasionally, it's needed, right, for happiness. Focus on eating real food. And let me show you what that looks like. So nutritional support. So here we have our anti-inflammatory foods, whether you're doing an anti-inflammatory nutritional plan or something else, selenium-rich foods, iodine-rich foods, zinc-rich foods, inositol-rich foods, and cultured foods. So I'm going to walk through those. And these are more in detail in your guide, so you can follow along with that. So our anti-inflammatory foods, these reduce chronic inflammation. And I've already talked about how important that is for the function of the thyroid gland. So turmeric, ginger, cinnamon, colorful vegetables, and bone broth. These are an important addition to your daily dietary plan. Selenium-rich foods. Your thyroid needs selenium. What it does is it aids in the conversion of inactive thyroid hormones. So you have the thyroid and the hormones in there are not doing anything at the moment. That selenium comes in and activates them, especially the T4. And the best food source of selenium are grass-fed beef, scallops, shrimp, and if you don't eat any of those things, if you're vegetarian, Brazil nuts. I think it's very few Brazil nuts you actually need to eat to get the recommended needed dose of selenium on a daily basis. Iodine-rich foods. So this is not for someone who has hyperthyroidism or Graves' disease, but iodine is highly correlated to thyroid function. And what it does is important for the synthesis of thyroid hormones. So your thyroid depends on iodine so much, and iodine deficiency can lead to thyroid disease. It's not as common, but it is when it comes to hypothyroidism. And the best food sources are iodine are eggs, seafood, and any sea vegetable, especially kelp. Okay, our next one is our zinc-rich food. Zinc is an essential mineral with many vital functions in our body, including metabolism. So you know why that would be so important, right? And supporting the immune system, very important for immune function. Zinc also plays a critical role in thyroid hormone balance. So it lowers cortisol levels when we're in that state of stress. That's that stress hormone, which then balances our thyroid hormone. And zinc is also important for the conversion of T4 to T3 when the thyroid gland is telling then the anterior pituitary gland what it needs. So the best sources of zinc are beef, turkey, salmon, chickpeas, brown rice, and flaxseed. So all those are good. You have some good alternatives depending on your current dietary plan. Inositol-rich food. So inositol is also known as B as in boy, B8. It's not a vitamin, but rather a sugar molecule. Inositol has been shown to reduce levels of thyroid antibodies, and along with selenium, can reduce inflammation, reduce autoantibodies, and improve thyroid function. So very important. And you can get inositol from grains, legumes, and beans, such as oats, buckwheat, and chickpeas. So if you're eating a autoimmune paleo protocol, AIP, diet or nutritional plan, you're not eating any of those. So taking an inositol supplement would be very cultured foods. So healthy thyroid function relies on the health of the gut bacteria. So it depends on those to function, to convert a portion of T4, the inactive form, into T3. So we've got to have those yummy probiotics that you can see on that beautiful picture there. And the body also relies on the gut bacteria to properly utilize T3 in the blood. So it's very important. And some examples are sauerkraut, kimchi, kefir, and yogurts. And I really recommend dairy-free when it comes to thyroid because it can be inflammatory. Okay, number 3 is supplemental support. So I just talked about all of those foods. So now we're going to see them in a supplement form. One thing about the gut, if you're having gut problems, gut dysfunction, gut dysbiosis, and you're taking supplements that your body needs to break down, it's not going to do it. You're not going to absorb it. So you need to get it from food and then fix the gut and then take the supplements, right? Because if you're taking supplements and your gut's not absorbing them, you're just peeing them out, waste of money. So again, selenium, you can take that as a supplement and it's helpful for thyroid antibodies. It helps with anxiety, and it also really helps with hair loss, which is a huge component. I see that highly connected with thyroid issues. I have many of my thyroid patients, and that's one of their biggest concerns, because as women, that's an image, right? We have that image of we want to have hair. And so that's very common, that hair loss, you'll like patients will say, oh, I have huge amounts of hair in my tub. And so selenium can help with that. Iodine is an essential mineral that I mentioned, and vitamin D3, super important. I didn't talk about vitamin D3 a lot, so I'm going to do that now. It's a fat soluble vitamin that your skin can produce when exposed to sun. It's so important for us to have our daily sunlight. So when we can't get enough vitamin D from the sun or our diet, both of those things together, supplements are often required. And many people are having a vitamin D deficiency. And that's a lab that I completely recommend doing so that it can be targeted for your therapeutic dose. Vitamin D3 is also highly anti-inflammatory. It helps support the immune system. And so the three main things it's for: it supports a healthy immune system. It helps prevent seasonal mood changes, great for SAD, seasonal affective disorder, and it protects the parathyroid gland. So very important in combination with supporting the thyroid system. So probiotics, I mentioned probiotics are so key for gut health and the thyroid, and it has a tremendous impact on our health than we ever previously thought before. We're really learning a lot more about the microbiome and how our body functions and the support of the system of the gut, the microbiome in the gut. And probiotics lead to a healthy gut microbiome. We need that. It also helps convert T4 to T3, again, needed. And so we need to have this abundant and diverse gut flora, and it's going to decrease inflammation in the body. And so the main things that probiotics is going to do is going to affect thyroid hormone synthesis. Very important. And it aids in the conversion, like I said, of inactive thyroid hormone T4 to active T3. So bringing in a probiotic supplement, that's really important to your supplemental support. Zinc, as I mentioned, is an essential mineral also for the immune system and for thyroid function. It balances our thyroid hormones and converts T4 to T3. So you can see just on these supplements alone that the thyroid needs a lot of supplemental support. So herbal support, there's lots and lots of great herbs. I am a huge herbalist, and I just put a few on here for you. And that is a typo there on the slides. I'm sorry, that should say lemon balm and says lemongrass. So I apologize for that, but it's correct in your guide. So herbal support. So one of my favorite herbs to use for the thyroid gland is ashwagandha. And ashwagandha is well-known plant in herbal medicine. It's often used to reduce feelings of stress. It's an adaptogenic herb, which means it helps us to adapt to stress. It reduces stress and anxiety. And it's important because it helps us when our thyroid is in a place of stress. Like I mentioned earlier, we need to have herbs to help support us. So ashwagandha is a great herb, and it has very few contraindications. So lots of patients can take it and they find that it really helps energize them. And a big part of it is its ability to balance hormones. So it's adaptogen. It helps us adapt to stress, and it balances our hormones. And studies have shown that taking ashwagandha can improve levels of thyroid hormones and can restore nearly normal functioning thyroid gland. So that's a huge aspect of study when it comes to ashwagandha. So really important. And lemongrass and mother is not correct. Like I said, it's lemon balm and motherwort. So sorry about that. So motherwort, the one on the bottom there, is used by herbalists and myself for anxiety and heart palpitation. It helps calm the body, making it an excellent choice for the relief of hyperthyroid symptoms. So we have hyper and hypo. Motherwort and lemon balm are used for an overactive thyroid. So studies show lemon balm can block thyroid stimulating hormone receptors and inhibit the binding of autoantibodies. So that's why we don't use lemon balm if you're hypothyroid. So just as a caveat there, you'll see that sometimes it's contraindicated depending on your levels. Okay, the fifth one here is Aromatherapeutic Support. So I listed a bunch of essential oils here, and they're really great. So we use ones for hyperthyroidism and hypothyroidism, and you'll see that more in detail in your guide. And so you can how to use these. And if you're just getting started, maybe you've never even heard of essential oils, or maybe you have and you're just, where do you even start? So I would just start with ones depending on if you're having an underactive thyroid or overactive. So going back to the guide and looking to see which category, and then picking one that you want to just start with one and trying and seeing if it helps. So you apply 1 to 2 drops of oil just to the base of the neck, just over the thyroid, right on the front side here. So we have the thyroid gland. It's just going to be the base of the neck, right? We have this little indentation. And then also on the lower lumbar of the back over the adrenal glands. So our adrenal glands, if you feel your back right now, you can feel where your rib cage are. They're right underneath the rib cage on the lower side of the back. So then when selecting essential oils for the thyroid, choose oils with stimulating properties for symptoms of an underactive thyroid, and choose oils with sedating and calming properties for symptoms of overactive. Okay, so that should give you some grounds to play with there and experiment. Okay, and then crystal support. Crystals can be a great way, number 6, for really helping in your, I like to use them a lot for when I'm sleeping or relaxing, meditating, also in my environment. So in your guide, I went way into detail about all the different benefits of these specifics. So I'm not going to go into that now, but I'm just going to highlight them. So we have quartz, onyx, blue agate, aquamarine, topaz, jade, rose quartz, and citrine. All of those will help the thyroid gland and also help the symptoms of dysfunction. And that is like depletion of your energy, actual energetic depletion, like from the spiritual aspect, increasing your memory, focus, alertness, protection, allowing you to communicate better. So all of these are going to help with those specific symptoms or signs that you might be experiencing. So number 6 is lifestyle support. And I put on here, I put the Autoimmune Protocol. Now this is specifically if you're having autoimmune condition like Hashimoto's, thyroiditis, or Graves' disease. So an autoimmune cause accounts for 90% of adults with hypothyroidism. So I'm really focusing here on Hashimoto's. And while treatment with the thyroid hormone replacement is sometimes, it says often here, I wouldn't say always necessary, often or sometimes necessary. It's usually I go to it my last. I want to help a patient naturally, do everything we can. Then if there's not a shift in the system, then bring on a pharmaceutical, Synthroid. So the autoimmune protocol is called AIP, and it focuses on making dietary and lifestyle changes to alleviate symptoms and manage your autoimmune disease by healing the gut and reducing inflammation. So we're going about healing the thyroid through the gut. And the diet component is very similar to paleo, but it's an elimination diet. So you're eliminating many of the inflammatory foods. That's for 30 to 90 days, and then reintegrating those back in to check for a resurgence of symptoms. So number 7 is detoxification. Like I mentioned, remember, I talked about toxins earlier. Now we're talking about the step we need to get rid of those toxins. So reducing endocrine disrupting compounds. They disrupt hormones in various ways, like they affect the synthesis, metabolism, and the binding of hormones to receptors. Endocrine disrupting toxins and xenoestrogens have a profound effect on the thyroid gland. Maintain hormone, the hormonal changes, especially a decline or excess of estrogen, has a substantial impact on the thyroid and immune health. So having some support for detoxification is really important. So supporting the detoxification pathway. So that's doing a detoxification, or maybe more intense, where maybe you did a heavy metals test and you found there were heavy metals like mercury and aluminum in the system, and doing a detoxification with that, or doing a 30-day genetic detox with me, whatever that is, doing some detoxification to reboot the system, get the liver working, and get those toxins out of the system to allow the thyroid to function properly. Number 8 is sleep hygiene. So it's very important to have proper sleep hygiene. So evening self-care rituals set the tone for relaxation. So you can shift into that restful sleep. So this is part, remember, number one, I talked about the routine, but a lot of people need to have more in-depth care when it comes to sleep because they're highly correlated. Not being able to sleep through the night, having insomnia, cortisol imbalance connected to the thyroid gland. So again, getting ready to sleep 30 minutes ahead of time, turning off devices and making the time for self-care. Consider herbs and supplements if you need to for support. Incorporate an evening self-care ritual like an Epsom salt bath, gentle yoga flow, or meditation. Feng shui your room and make sure it's uncluttered, temperature controlled, and comfortable so you can sleep through the night. And journal. So journal's a great way to help you feel grateful for the day and really like sometimes do a brain dump if needed, letting go and releasing before bed. So sleep hygiene is so important for restoration when it comes to the thyroid gland. So managing stress. So I talked about the importance of stress and correlation with our stress hormone cortisol and how it's highly connected to the dysfunction of the thyroid gland. So we've got to have aspects to manage stress. Managing stress, studies have demonstrated that psychological stressors can induce changes in immune regulation, which then especially affects the thyroid gland if you have Hashimoto's or Graves' disease. So both direct and indirect stressors cause an imbalance, such as direct stress. And mindful breathing is a huge one when it comes to a way to deal with stress. So breathing activates the body's rest and digest nervous system, that parasympathetic nervous system. So the sympathetic is running from the bear, that like fight or flight. And then this parasympathetic, which is what we want to be in for complete restoration of the thyroid gland. That's the parasympathetic nervous system. And when we activate this part of our nervous system, that stress response is turned off and the body can rest and heal. And then number 10 is self-care. So in your guide, I put all of these details or all these things more in detail about how to do them. And what I recommend when I'm working with patients, or if you're thinking like, okay, I'm going to try some of these 10 steps, just start with one and then see how that goes and then bring another one in. Like you start with everything at once, you don't always have compliance, you feel frustrated, you don't have the energy. So pick one, but I'm going to talk you through the oil pulling. So that's when you're doing a oil pull of a tablespoon of oil in the mouth, such as coconut or sesame oil. You swish it around in the mouth for 5 to 15 minutes. So it's a kind of a long time. And then what it does is you don't swallow it, you spit it out and it pulls all the bacteria. I always do that when someone has the gut connection because we want to get the bacteria out of the gut. And that always starts at the mouth, right? So we have the mouth and the anus, that's part of the tube. And we want to be able to get rid of that bad bacteria. So you can start with 1 minute of swishing and then work up to larger amounts. Tongue scraping. So tongue scraping is a simple strategy, again, for detoxification. You get those toxins off the tongue and start with that detoxification in the mouth. Body brushing. This is super easy and very important, especially for stimulating the lymphatic system. We need that for our immune system, especially if you have an autoimmune thyroid condition. So regular body brushing in the shower. So you dry brush before you get into the shower and then you rinse it off. So you rinse off all the dead skin and you're increasing the lymph system. If you're interested in that handout, I have a separate handout for castor oil packs and for doing body brushing, just send me a message, email, or DM me on Instagram and I can send you that link. I'd be more than happy. Juicing or smoothie batch days. So doing what I recommend is having 1 to 2 days a week where you're doing a big batch of smoothie prep. And what I like to do is to have little baggies. I use the silicone, not the plastic, where I can reuse it and freeze it. And then I put it in the freezer and all I have to do is pull it out, right? In a great smoothie. You could also make smoothies ahead of time and then freeze them and thaw them out. But I don't like to do that because I don't like them that cold. But in the summer, that's better. Daily movement. You've got to have some kind of movement. Now, when it comes to thyroid issues, especially hypothyroidism, Hashimoto's thyroiditis, adrenal fatigue, adrenal exhaustion, doing heavy duty cardio can be very exhausting. So something restorative, walking, maybe you're doing weights, some kind of restorative care is important. A castor oil pack. So you can do castor oil packs, especially on the digestive system, on the abdomen, to reduce inflammation and restore leaky gut. And then daily visualization. and goal setting. This is important because you want to have a clear mind and change your perspective. When it comes to a thyroid condition, we have to change our mindset. Mindset has to be changed with all chronic disease, but especially the thyroid, because we've been suppressed in expressing ourselves, because with that energetic place is the chakra of the it's the fifth chakra, the chakra of communication. So when, as women, we've had that gland has been suppressed. So we have to have this change, this shift of mindset to then be able to have that complete healing. So visualization, doing daily meditation, doing journaling, doing active programs like mine, the Own Your Power, to really getting into that owning your power place is important for the thyroid. Okay. All right. That was all of the 10 steps there. And I'm going to talk about my thyroid program that I have in case so let's wrap up things where we did today. So we talked about, everything in relationship to the thyroid, giving you those first 10 steps to really start to take charge. We talked about things that affect the thyroid. And also I talked about the importance of labs. But if you need more help, you're like, I think I need to be guided, I need more help, then I have a thyroid program that is perfect for you. And it's starting next week. And I'm going to tell you about what this program is about. So can get you super excited like I am. So really, if this is what if you're feeling this and you're experiencing this, exhausted, gaining weight, moody, just like feeling like crap, and you can't figure out what's going on, or you've either been tested or haven't been tested, you're like, okay, I know I have a thyroid problem, but I'm not sure what the extent is. I really need to work with Dr. LuLu. And this is a group guided program where you're experiencing the healing, amazing collective group energy, which really helps us transform and grow. So what's included in this program, you get my thyroid recovery guides, a hormone reset, and hormone mindset, both of those coming together. Regain your power. So you're going to regain and learn how to use your voice. You get a free complimentary 30-minute consultation with me to discuss labs for ultimate success. This is priceless in the program. You get empowered education, weekly mini educational videos and meditations to empower your healing, to really dive deep into that mindset component. You get a nutraceutical thyroid blueprint. So my top protocol to help improve your function and get you feeling amazing again. Thyroid nutrition. So you're going to get a full meal plan for the program with recipes, shopping lists, and everything to really have it done for you for complete and ultimate healing. You're going to get some bonus handouts going grain-free, which I think is very important when it comes to the thyroid recovery. Hormones and detoxification, more intense details on that. Probiotics and hormones, teas for liver detoxification, and thyroid balancing foods. So all of those, you get those bonus handouts with the program. Mindset guides, you're going to have a gratitude journal. Sorry. A gratitude journal and a law of attraction planner to really help you tune into attracting that healing and also then processing and letting go. You're going to have daily emails with information, tips, tricks, support, advice, and so much more. You're also going to have a community group support. So this is a community program where you can share stories, get support. We're going to meet once a week together to have a meditation, talk about the theme for the week, and express and communicate with each other about our journey of healing. What can you expect from this program? So at the end of the program, you're going to have tons of long-lasting all-day energy, more restful sleep, clearer thoughts, sharper memory and mental acuity, healthier glowing skin, more joyful, peaceful mindset, free from stress, anxiety, and overwhelm. Sounds great. I love this program. So if this sounds like it's something that you're interested in, this sounds like the complete amazing alignment and sync for you, I'm going to tell you right now how to sign up. And also, if you have any questions about it, you're not quite sure, message me so I can help guide you in the right direction. What are you waiting for? If you currently have a thyroid condition that you need to get on track, this is the year to do it. Your body and mind are crying out for healing. Now's the time to take that first step towards reclaiming your health and energy and get that happiness and joy that you deserve. So join me for my 6-week guided thyroid recovery program. And you all attendees of tonight. And if you're tuning in, watching the replay, you can get $100 off that program. And you can use the coupon code Thyroid Health 22. And I'm going to take you right now to my website so you can see how to sign up. And there's a link there to doclulu.com/thyroid/recovery. And I'm just going to go to the website here so you can see. So if you go to my website, isn't it pretty? I love my website. If you go to programs, you can see all the different programs that I have here, and you click on thyroid recovery, and there's a couple options for you. You can see I have a roadmap. This is the different steps to get through thyroid recovery. If you're not ready to jump deep into a 6-week program, you can take a quiz, find out where you're at. You can watch some of my past thyroid webinars. You can do a 5-day thyroid recovery. This is a little mini reboot. And then you can dive deep down into the program. Starts on February 7th. You can just click here to sign up. Super easy. And then you use the coupon code, which was Thyroid Health 22. And you can learn more about the program here. All of the things that we're going to discover and learn more in detail. It talks more about what's included, etc. Okay, I'm going to go back to, so yeah, that is the program. I'm so excited for it. Let me go back to here. Okay, so if you're interested in signing up, make sure you do that. It starts next week. So I want you to be involved so you can start your healing journey. So again, thank you so much, everyone, for attending tonight. I hope you learned a lot. More information about me, look at my website. I just showed you. That's doclulu.com. Follow me on Instagram at Dr. Lulu Shimmick. I'm always talking about health tips, recipes, free webinars, programs, and more. Listen to my podcast for weekly info and health tips. That's the Genetic Genius on Apple Podcast. So now I'm going to take questions. If anybody has any, you can put them over in the chat and I'll answer them, or you can raise your hand. And someone said, thank you so much. You're so welcome. I'm so glad you could attend tonight, DS, and I hope you enjoyed it. Does anybody have any questions? I'm going to look over in the Q&A section too. So you can pop them over there if you have any questions about anything I talked about, any of the thyroid protocol I mentioned, my 10 steps. I know I went over a lot of information, so you might have to go back and watch it again too. Does anybody have anything? Okay, it doesn't look like it. Again, if you have follow-up questions from tonight, please feel free to reach out to us either on Instagram, you can message us, or you can send us an email at info at Dr. Lulu Shimmick. I'm going to put that in the chat right now for you. And you can email with any questions. And I can't wait to see you all in the thyroid program. I'm so excited. It's going to be amazing. And I can't wait to see you in some future webinars. So keep tuning in. I have lots of great stuff coming up for February and 2022. So thanks again, everyone, and have a great evening.